African-American history, known for her scholarship and journalistic excellence. So with that, I will mention that I am joined by members of my cabinet who will participate in the discussion today, including the Chancellor of DC Public Schools, the Deputy Mayor for Education, the Director of Department of DC Health, and the Director of the Department of Behavioral Health, Dr. Barbara Bajron, who told me she was delighted to be here today. This morning, DC Health announced 38 new cases of COVID-19 in our community, and sadly, another Washingtonian has lost their life. I am showing, as we do each day on coronavirus.dc.gov, the metrics that DC Health follows very closely in evaluating how we continue to respond to COVID-19 in our communities. So members of the community can continue to look for how the district is responding to coronavirus.dc.gov. Yesterday, we also made an important announcement regarding testing. As you know, we have stood up citywide testing at what we call drive-through and walk-up sites, as well as at firehouses across the District of Columbia. But we also want to remind DC residents that the best way to not only get tested but monitor your health is through your own provider. And I have required that insurance companies provide free testing for people who work in high-risk settings, are at risk of complications from COVID-19, and have been exposed to a person who has been diagnosed with COVID, regardless of their symptoms. So asymptomatic people who work in high-risk settings are at a high risk for complications from COVID and have been recently exposed to a person diagnosed with COVID. And we know that our providers are looking forward to complying with that. Further, Dr. Nesbitt wants us all to remember, and I do too, and everybody assembled here does too, wants to remind everyone, despite the fact that kids aren't reporting to a school building, we still need families to stay on track with their vaccinations. So let me ask Dr. Nesbitt to say a little bit more about that.
Sure. Thank you so much, Madam Mayor. Every year, we take the opportunity during the back-to-school season to remind parents, families of the importance of vaccinations and how critically important vaccinations are for us to reduce vaccine-preventable illnesses such as measles, chickenpox, etc. This year, because of the impact of COVID-19 on our healthcare system and accessing child visits, we have experienced an unprecedented decrease in childhood immunization rates, and particularly amongst the school-age population. So we want to make sure that all of our families are taking advantage of the increased resources that have been made available for families to get back on track with childhood immunizations and to stay on track with those vaccinations, and making appointments with their healthcare provider or visiting our school-based health centers that are located in the district to have their children be on schedule. While learning will begin virtually, and we know we'll spend the bulk of today's time talking about what that experience looks like, we want to make sure that our children are still protected and have all of their vaccines. And so as soon as the in-person learning experience can resume in the district, all of our children will be up to date with their required vaccines. We have created some flexibility with our school-based health centers, which traditionally would serve the students in those high schools or their children, but now they will be open to serve other students in the community as well, and those school-based health centers are listed here. I do want to not miss the opportunity to also encourage people, as flu season will be upon us, to make sure that in addition to the required annual vaccines for children or school vaccines for children, that all of our children will have the influenza vaccine, as well as all of us, actually, because the flu vaccine is recommended for everyone above the age of 6 months. So thank you so much, Mayor, for giving me the opportunity to highlight this important issue.
And thank you, Dr. Nesbitt. Before we move from the slide, I just want to reiterate what Dr. Nesbitt said, that the listed locations are school-based health centers that are available for families. You can call and schedule an appointment, and you can have immunizations done at these locations. Anacostia High School, Ballou High School, Cardozo Education Campus, right here at Coolidge Ida B. Wells campus, Dunbar High School, Roosevelt High School, Woodson High School, and the MedStar Georgetown Mobile Clinic at Kelly Miller Middle School. So please note that and make your appointment. The last thing any of us wants is a rush where everybody wants to get their immunizations at the same time. If we're all calling and scheduling our appointments with our healthcare providers now and with our or at the school-based health centers, everything will be orderly. So thank you for doing that. So now I want to turn over the conversation to Dr. Bazran. And as I mentioned, Dr. Bazran is our director of the DC Department of Behavioral Health. In addition to her expertise in behavioral and mental health, Dr. Bazran has been a teacher and a school principal. So she is well equipped to help our families through these extraordinary and often challenging times. DBH has been working to put a number of resources for parents and families together because we know and we hear more and more about the stresses and anxiety that this global pandemic has created in our homes. And so we want to make sure everybody is availing themselves of all resources. Dr. Bazran.
Thank you, Madam Mayor. DBH is working with the Chancellor and the other education partners within the district to launch the school-based parental support program to support parents in the district who, like those across the nation, are experiencing higher levels of stress as they seek to manage the demands of parenting responsibilities, work, distance learning, and the impact of being sequestered for many months with their families. This effort is focused on promoting mental wellness for the whole family as they deal with the day-to-day stressors that we are all feeling related to the COVID-19 pandemic. We have crafted this program to make it easily accessible for busy families. DBH will provide easy access to mental health services and support through its 24-hour mental health hotline that you can call at any hour of the day, any day of the week. The hotline is staffed by licensed social workers, psychologists, and counselors, including bilingual clinicians who can address crisis situations, offer guidance to address family stressors, and link parents to school-based clinicians or early childhood specialists. All services are confidential and will be provided at no cost. Parents can access the service by calling the number on the screen, 1-888-793-4357. In addition, individualized services and supports to support mental health well-being are also being made available to parents and families. Licensed clinicians will provide brief counseling and consultation and linkage to more intensive care if required. This includes addressing grief, loss, and trauma related to the loss of a loved one, and parents can receive up to 3 consults as follow-up visits. Assigned clinicians have expertise and experience that is required to serve parents of children of all ages from early childhood through high school. Next, one of the things that we're really excited about is we are building an online support network for parents. It's called Wellness Wednesdays, which will be weekly, interactive, live, online parent support groups. Wellness Wednesdays will be offered from 5:30 to 6:30 p.m. to accommodate those parents who are working during the day. These sessions will also be staffed by licensed clinicians and will focus on building resiliency and will provide an opportunity for parents to connect with other parents and share their experiences and provide mutual supports. Wellness Wednesdays will begin on September 2nd, and the topic for that session is self-care for parents. This online support will be featured on WebEx and available for parents of children birth through high school. Thank you, Mayor Bowser, for the opportunity to share a brief overview of the Parental Support Program, which will be available, as I said earlier, beginning September 2nd. I will now turn it over to Chancellor Farabee.
Thank you, Chancellor Farabee. Let me also add my thanks to you and the entire DCPS team for being flexible and working quickly to ensure that our families have a robust experience for the start of school while we are in a virtual status. Chancellor Farabee.
Thank you, Mayor Bowser. I want you to know I share Dr. Bazran's excitement as we are approaching the start of school as well on Monday. We're also pleased to be partners with the Department of Behavioral Health, knowing that many of our students and families need the supports of our professionals and our clinicians during this time, and schools are planning diligently for trauma-responsive practices. We're thrilled to receive students on Monday, and we will begin our first term on the 31st, and it will go through November 6th, and the first term will be learning at home for all of our students as we continue to plan for in-person experiences, and will provide information to families accordingly. As we ramp up into the first day of school, a reminder to everyone that we still need families to enroll. So if you were a student last school year and you may be thinking there's nothing to do, just log in on Monday. We still need you to enroll. So we're asking all of our residents to reach out to families of school-aged children to make sure that they've enrolled. They can do so by going to enrolldcps.dc.gov. Again, that's enrolldcps.dc.gov. Once families have completed the enrollment process, if there's a need for a device or if the need for support with internet access, they can reach out directly to their school once they've completed the enrollment process. Schools are now facilitating distribution of devices and hotspots, and that will look different based on the grade level for the student. And so for our pre-K3 and pre-K4 student, their device is the iPad, which we believe is the most developmentally appropriate for that age group. And then for our elementary age students and our secondary students, they will either receive one of these devices before me. That includes the Microsoft Surface Pro or the Lenovo or Dell laptop. And that process, again, is already started, and schools have schedules, and we're encouraging families who need devices or support with internet access to reach out to schools directly. Many of our devices are now LTE enabled, so if a student doesn't receive a hotspot, they'll receive a device that connects easily to the internet. We are also providing information to families on the tech requirements for learning at home. So for those that already have a device, we want to ensure that they understand what capacity, what bandwidth, and what platforms will be operating for this school year. Our learning system for synchronous and asynchronous learning is Microsoft Teams. This is where families can log in for instruction, where they can see their teachers and their peers. We're very confident in this solution. It is a very secure solution for our students and their instructional experiences. We're also providing information to families about Canvas, which is where they can go and access all of our learning materials. There is a Canvas companion for every grade level and every content area where families can easily click on the curriculum resources and also any supporting documents or textbooks that have been digitized for students for this school year. Going forward, we also want to remind families that logging into Canvas each day is our means for attendance, and we are expecting students to be engaged every day. Schools will take attendance on a daily basis, so it's important that students log in at their designated time, and schedules have been released for all of our schools, so students can now log into our Aspen Student Information System to access their schedule so they know what time that they're expected to be in class and logged in. And again, this is how we will take attendance on a daily basis. And as we're always reminded, every day counts, and we want to ensure students are actively engaged each day. To prepare for this school year, we are leaning back on our guiding principles related to our vision and values for our capital commitment, and that is to ensure every student feel loved, challenged, and prepared. As we think about the aspect of feeling loved, we know that our students are entering the school year like no other, and it's critical that we develop relationships early on with our students and families. We spend a lot of time helping and prepare our educators to reconnect and connect with students, knowing that for some students this will be the first time that they will engage with their instructor and would have not had any in-person experiences. And so we will spend the first few days ensuring that those relationships are established early on. As we think about challenge, it's important to note that we will be introducing new content for students throughout the first term to ensure that they're advancing in their academic studies, but we're also thinking about how they can reflect on this time period that we are in. And so we've established a Living Through History cornerstone, which is an opportunity for students to experience a cross-disciplinary opportunity to reflect, to advocate, to communicate their thoughts and feelings about where they are in this time period as relates to some of the unrest that we recently experienced, and also some of the experience associated with the pandemic. And then finally, prepared. We are thinking about all of the tools and resources that our teachers have worked on throughout the summer in preparation for this school year. We had over 200 teachers come in and work over the summer to transfer our curriculum to a online approach, and we're very confident that we provided the tools and resources to our teachers, and those resources are also available to our students for a successful start. One of the areas that we are also wanting to emphasize for our students, particularly our high school students, is that we still want them to be engaged in our society and be active members. And so we're encouraging students to continue to seek out volunteer opportunities and community service opportunities, such as being poll workers for this election season. We know that students are working to earn hours towards their graduation requirements, even though we're in a learning at home posture. And so we continue to encourage students to do so and log their hours accordingly. As we go forward, we want to also remind families that we're in lockstep together as we approach this school year, and we'll continue to provide a number of resources for families to ensure that we start strong. One of those resources is our Family Guide to Learning at Home. This is a resource that families will receive this week that provides more information on tech tips, attendance guidance, grading, all the information on the essential resources that we're providing, some of the mental health supports that have been described today, and just overall resources for families to have a successful experience for learning at home. And finally, an additional information on our Parent University, which is in process now and will extend to mid-September. We're in this together, and we are ensuring that our families are prepared for a successful start, and we're prepared to reopen strong.
Thank you, Chancellor. And Deputy Mayor Kine, if you would talk to us about the more engagement that we are doing with families.
Thank you, Mayor. And I wanted to, first of all, just reiterate your thanks to Chancellor Farabee and your entire team, Chancellor, and in particular your teachers and school leaders. We feel grateful to all of the educators across the city for their phenomenal work to stand up high-quality virtual learning for all of our families. And of course, today we're here to describe what DCPS is doing, but I wanted to make a few points about our citywide system of public schools. Firstly, this evening, the Chancellor and I will appear in a telephone town hall, a teletown hall, to discuss DCPS's first day of school. So please feel free to dial in. You can see the phone number there. Secondly, I wanted to reiterate the Chancellor's point on enrollment. It's critical that families understand that even in a virtual environment, you must go through the same enrollment process that you have gone through every single year in order to successfully establish relationship and contact with your school. So for DCPS and public charter school families, please, please, please enroll and be in touch with your school so you can do the preparation you need in order to kick off successfully. Thirdly, one of the big reminders we've gotten over the course of this pandemic is that schools play a vital part in the heart of their communities. It's not just teaching and learning, but it also includes such supplemental supports for families as behavioral health, as Dr. Basram was describing, and student meals. And this fall, in the virtual environment, we will continue to provide free and reduced price meals to all students who need them. There is one important change this fall that families need to understand, and that is that your meals now will be provided by your LEA. So it's critically important that you are in contact with your school to understand what the sites are for you to pick up your free and reduced price meals. Your LEA will provide those meals to you. And that's because of a change in the U.S. Department of Agriculture's approach to the provision of these meals and the way in which we are reimbursed. So again, please be in touch with your school, understand the school sites you can go to collect your meals, and you will be provided the meals as we have been doing so. Lastly, I did want to say a word about Kids Ride Free. And of course, the vast majority of our schools across the city are in a virtual posture, and students don't necessarily need these cards now. However, I wanted to mention that the current cards are valid through the end of September, so students can continue to use last year's Kids Ride Free card for things like equipment pickup and visits to schools through September 29th. We have distributed next year's Kids Ride Free card to schools, and schools are making arrangements to distribute those cards to the students who need them. We want to be ready for the second term, if health conditions allow us, to begin our hybrid in-person instruction. Kids belong in schools, and we are making every effort to ensure that we are ready to be back in school should health conditions in our city allow it. So with that, Mayor, I will turn it back to you.
Thank you. So I want to thank everybody for their presentations, and we're happy to answer your questions. And JC, we're going to excuse you from this portion. So thank you, sweetheart. Okay.
Excuse me for interrupting you, Mayor. You've heard all the officials talk today, but what's it like for students your age who cannot socialize with their friends and can't help each other in classrooms as you would normally be doing? What's it like for you to have to live in the virtual world and not be going to class?
Well, as you know, it's been some time. I've kind of gotten used to it by now. But we do find ways to communicate. We always keep in touch. And as for friends or studying, our teachers, as I previously said, make sure that we have all we need, all our supplies to be ready not only for school but for our daily lives. They make sure that we know that they have our backs, and it's how do I say it? It's gotten better. We had a rocky start, not knowing how to transition, but now we're doing good. Well, at least in my behalf, I could say that I've gotten used to it. I know how to take care of myself more now due to the whole situation. But yeah, it's doing well.
You'd rather be back in school?
Definitely.
Thank you.
Yeah. Thank you.
Thank you, JC.
Thank you.
Any other questions? Yes, sir.
Dr. Bazaran, In the African American community, mental health is a stigma. It is meant that if you go to a therapist or to a counselor, it's because you're weak. And a lot of times what African Americans did in the yesteryears, if I can say it that way, is that they would go to their pastor and then and talk to the problem to the pastor, and they pray it away, and hopefully the problem goes away. I'm curious, number one, have you reached out to the faith community in terms of this initiative that you have? And talk a little bit about why that stigma is so bad.
Well, first of all, I think we're really facing unusual times. This is a time like no other in terms of the stressors that we are facing. We have reached out and are working with the pastoral community, providing information and support to individuals who are impacted through COVID-19. And we're doing that with resources from some of our federal grants, and those activities are ongoing. However, stigma, I'm so glad you asked that question, cannot be a barrier to getting the support you need to make sure that you can build your resiliency as a parent, and that you can be able to support your children as well as your family members. Healthy parents support health and well-being among their children and other family members. And so my hope is that we all call that number as we need to, and that we bust the stigma related to mental health.
Any other questions? Yes, Carrie?
I have a question. First, starting on mental health, I heard Deputy Mayor Kine, who had said at a recent state board meeting that there was going to be some effort to get mental health workers physically into the communities. And I think that was maybe a DCPS effort, not a DBH one. And I'm curious if one of you two could please talk about if there are any efforts to get face-to-face interactions with mental health.
Actually, Barry, I'll let Dr. Bazran answer that question, because it is indeed a DBH issue. Some of the DBH clinicians have in fact been working in the communities, and they plan to continue that. But I'll let Dr. Bazran
Can you
speak.
repeat Perry's question?
I'm sorry. Perry asked about whether or not we will have any clinicians doing community work in person, as opposed to having it all be virtual.
Thank you for that question. We know, as you know, through the amazing support we have received from Mayor Bowser, we do have school-based clinicians and this year it will be 161 of our public schools and public charter schools. And those clinicians work with families to address prevention, intervention, and treatment needs. Many of our school-based clinicians have been out there throughout the summer working with families in community. In addition to that, we do have our community response team, which is a core of clinicians that are working every day, 24/7, in the community to address mental health needs of our families.
And would you say in communities, in homes, in recreation centers, in yards, parks?
Our clinicians, as well as the members of our community providers, are working in all of those venues. They're working in the communities. They are going where people need them to be to provide those services. And that has happened throughout. And this is particularly for individuals with high-end needs. We are providing that support.
And thank you. And Chancellor Fairby, on the DCPS, I saw in the frequently asked questions page you guys set up is you were encouraging after-school providers to work with the school system to kind of set up small groups of in-person learning things with students so they can do virtual learning if they need that childcare. My two questions are, will you be using DCPS space for that? And why does the school system feel if it's safe to do that, they can't do kind of small DCPS run, education?
So as mentioned earlier, as we start the school year, we will continue to explore in-person experiences for students and staff in our buildings. We're starting to provide guidance for our principals on our ramp of a scaffold of what that could look like as we broaden the number of students and staff in our buildings. We had several partners reach out to us about the opportunity to continue to serve students. And so we've given them guidance, and we'd like for them to work directly with our school principals. And our school principals, it's important to note, are also having conversations with staff that are also interested in coming into the building as well. So we'll be providing more information to families. Obviously, we will prioritize the services from a lens of equity in terms of who would receive such services, and we'll be providing that information to families as those plans are developed.
So in the first few weeks of school, will any private providers be using DCPS facilities to supervise, watch kids in any capacity?
So for the start of the school year, we will not have partners providing services in buildings. We will provide information to families at the point in time in which we're able and ready to provide such services. However, it's important to note that we are continuing to provide our infant and toddler care for those providers that are in DCPS facilities that serve those age groups.
Yes, sir.
Hi, Valerie. How are you today? I have a question. On Monday, there are a lot of videos that came out where there are protesters approaching diners a little aggressively in outdoor restaurants throughout D.C., asking them to stand with solidarity about what's going on. Obviously, social change right now is at the forefront of everything. It's important. But, we had an Insta poll out on our station. We polled about 500 of our viewers. 92% of them, they came back and they said that they just simply don't feel safe eating outside in D.C. restaurants when you have protesters going around and almost accosting them, getting right into their faces. I know social change is at the forefront right now. Do you think this is the right way to do this?
No.
What should be the right way?
What should be the right way?
What should be an appropriate way in your mind to protesters should be acting? Do you think they should be going up to people just trying to dine out in our restaurants?
I don't.
Do you have any comment about this?
What I saw, and I don't have any comment on your Insta poll, but what I saw in those videos was highly inappropriate. It was likely against the law if they were on private property. But more importantly, I don't think it had anything to do with demands for social justice.
What do you think it had to do with?
I have no idea.
Will there be any enforcement if this thing continues?
There should be enforcement anytime the law is broken, and we would encourage any diner or restaurant to call the police immediately.
Okay. I guess with everything going on right now, do you think there's another way for protesters to go around instead of approaching these diners like this?
I think I've answered that question.
Okay.
Next question.
Yeah, Mayor. I'm just interested in, whatever you have to say to us about progress of the march that's going to be happening in 2 days, and will you be speaking at the march?
I will not be speaking, and I don't think we have anything to add from what we talked about on Monday, Sam. The March logistics, I think, have been made available publicly. We expect activities in a seated area in front of the Lincoln Memorial on Friday morning, and we expect a procession from the Lincoln to the Martin Luther King Memorial, which is, just over a block away, to occur. And we would just continue to remind people, if you're not part of that seated venue in front of the Lincoln Memorial, then you don't really know if you're going to be in a socially distanced environment. So I would remind our residents of that. Tom?
Just on a follow-up before I ask my other question, would we expect maybe the chief will give us a briefing maybe Thursday on the status for Friday? Is that possible?
If we have a status change, but we've briefed out on the road closures. We'll continue. I think Director Rodriguez will be providing some press briefings leading up to Friday, largely around road closures, or if something has changed about our posture.
Thank you. I'd like to go back to the school's chancellor, maybe the deputy mayor. You're going to keep track of students logging in the morning and throughout the day as they complete assignments or participate. But absenteeism has been an issue in the public school system. Are you doing anything special now to make certain that you keep track of students who are not logging in or participating throughout the day?
So we'll continue to operate from our truancy procedures should students not be present and be actively engaged. In this posture, more importantly, it is critical that we continue to reach out to families should a student not log in and immediately try to understand and get more information around a particular absence. We also have provided a number of opportunities for students to take courses on a flexible schedule. So our high schools, for example, are offering twilight classes in the evenings, and our Opportunity Academies also offer flexible schedules. And so the goal is to find out from the family what the reasons are behind a particular absence, and if there's a need to adjust for the family or the student accordingly, do so. And if there are technology needs, be responsive to that as well. And we will continue to monitor attendance on a daily basis and follow up with families accordingly.
Thank you very much. If I could follow it up on this, you're trying as much as you can get hardware out to all the students who will need it for the classes, but there are dead zones within the District of Columbia. Is there anything you're doing to try to boost reception of the internet around town with temporary towers or anything like that?
We haven't heard any challenges with the hotspot or the internet services that we provided to students, but we are, again, in constant conversations with our students, and I've asked them to flag any challenges with logging into our learning platforms or any challenges with internet access.
Thank you.
Yes.
Just to follow up on that, obviously it's one thing to have the tools at your disposal, but in terms of being computer literate, knowing how to use it, are you confident that the district has enough resources to help those parents who have those day-to-day issues when it comes to troubleshooting, things like that? How is that going to work?
So we bolstered and built out our family supports for technology. So there are hotlines families can call, and there's also a number of videos of how to do various tasks and to log in accordingly. And we've had tremendous participation in our family sessions via our Parent University, which is an opportunity for families to ask us direct questions about how to, and we provided that feedback accordingly, and seen thousands of families get answers to their questions. So we feel confident that we've provided that information to date, and we'll continue to engage with our families as we approach Monday and beyond.
Yes. Dr. has two questions. Delaware being on the quarantine list, the Mayor Rehoboth called it a little bit of bad timing, pushed back on the fact that they said it was a data anomaly. You just talk about why Delaware remains on the list, and then secondly, CDC guidelines regarding 14-day quarantines and whether that change impacts any of those decisions you might make here.
Yeah, so a request from Delaware to review whether or not they should be on the list. As we understand their methodology and the reasoning behind their request, so we'll make a decision if appropriate. The CDC has made some updates to their testing recommendations. It does not impact quarantine, so I think people should be very clear about that. Their testing was never a replacement for quarantine, so as there may be a recommendation that people who had close contact under the CDC recommendations, which has not yet impacted what we're doing in the district, may suggest that people who have close contact don't necessarily need to be tested unless you fall under certain categories, has no impact yet on whether or not people who have close contact should quarantine, because testing has never been a replacement for quarantine. Yes, hope that helps.
A question about enrollment. You mentioned enrollment declines. Some of that, as you guys talked about, is because families may not know they need to re-enroll. But are you also seeing declines in enrollment in maybe in some of our more affluent schools, where families are opting for private school or pre-K families are finding other in-person options. Are you seeing any noticeable numbers there?
I'll just repeat the question. Perry is asking whether we're seeing declines in enrollment in affluent schools where parents may be making different choices based on the virtual posture. And the answer is no. We are seeing declines in enrollment in our youngest grades. So, for example, in pre-K, we've got enrollment lags where I think some families may be making a decision that rather than have their youngest children engage in virtual, they'll do something with them differently at home.
And that's across the board or across the city level?
That's across the city, yeah. That's the aggregate number.
And, I've heard from some elementary schools, specifically that computers distributions will start after school starts. I know you have said you can give every kid who needs a laptop. How many kids do you expect to be able to log on the first day of school? I mean, percentage-wise, or?
So I can speak directly for DCPS. The expectation is that all of our device distribution begins and ends prior to the start of school. We do have some of our smaller elementary schools that start later in the process because they have a smaller number of devices to distribute. But we will have distribution at every school prior to the start of the school year.
Yes, sir.
Dr. Farabee, there may be some mischief in terms of the attendance, and I want to follow up on what Tom was talking about. You have some students in the district who may not have stable home situations and who may not value education as much as they should, so they may decide at any given time that they're just not going to log in today or in some days. Do you have any mechanisms in order to address that?
So what you're describing, we experience in in-person structure as well when students are expecting to be in our buildings. And so we will continue to reach out to families. We have seen whether students are learning at home, learning in school, is regular communication between a caring adult in the school and the family is the best way to monitor attendance. And also schools have targeted approaches for students who have a history of poor attendance. And we see that in some students that gradually over time their attendance may lag, and we have targeted efforts for those students and families to ensure that they're off to a great start. And like I said earlier, we'll continue to monitor attendance on a daily basis.
Can I also just add on this point, because it's come up a couple times now. It's very important to us that families really understand that school is in session in Washington, D.C. And we have worked for months with the state superintendent's office to ensure that we can track in a very robust way at all of our public schools, DCPS and public charter schools, whether or not students are engaged. And this happens in two ways. Technically, we know that attendance will be taken every single day by every single LEA. In addition to that, we have required in all schools' virtual learning plans that they share with us how they will keep engaged with all their students and all their families. So we understand that they are doing lots of outreach, as the Chancellor is describing. We are tracking this, and all of our normal systems in terms of truancy, CFSA referrals, and all of those things to support families and help our system remain in place this fall.
Okay, yes, last question.
Just another quick follow-up question about the march in Washington. Have you been in contact with any of the organizers for that march?
We've talked about this on several occasions, yes.
Okay. And just lastly about again about the restaurants. Do you think people should be fearful when they go out to eat?
No.
How should they feel?
I can just tell you about experiences that I've seen throughout the pandemic, that DC residents are supporting local businesses, getting some entertainment and distraction for themselves, and helping to keep people employed by supporting our local restaurants. They're doing it with takeout and delivery. In fact, our restaurant week focus has been on how families can enjoy our local restaurants by having meals delivered or picking them up. They're doing it mostly in outside dining, and they're doing it in limited inside dining. And I would venture to say that the vast majority of those experiences have been 100% positive. And I also don't think that DC residents would be bullied out of living their everyday lives.
Thank you.
Yeah.
Mayor, the Republican convention is going on. There are some events that happen here in the city.
Yes.
I guess there's going to be fireworks Thursday. We had camera crews that noticed they were putting up 10-foot fences at 15th and Pennsylvania, I guess near the Treasury and White House. Any reaction to the stuff that's going on?
It is certainly an unusual set of circumstances, Sam. I think we weren't expecting to have any convention activities up until a few weeks ago when we learned that they would. When we have big events, we spend many, many months planning them with federal partners so that people will be safe in attending those events, and we can plan as best we can for any and all circumstances. So this is quite unusual. They have the ticketed events, I assume the event last night at the White House, and there's going to be another event at the White House on Thursday, pose the most concerns for us. The fireworks, not so much, because, you know, we've supported the fireworks display for many, many years. We still continue to urge people to not go to places where they cannot assure their own social distance from others.
You said the event on Thursday raised some concern. What are the concerns?
That there is going to be a seated event, so there will be a gathering of people. And I just think that anytime you have something at the White House, it could attract counter attention.
Mayor, you were part of the Democratic convention. Are you watching any of the Republican convention?
Yes, I am.
Any thoughts on what you've seen so far?
Well, since they're largely political, Tom, I'm going to stay away from those tonight. The thing that I will say that has been unusual for us is that these buildings, our buildings, the people's buildings, are being used for partisan purposes. And to draw a local analogy, it would be like me going into the John Wilson building, going into the council chamber, going on the steps of the John Wilson building and announcing my reelection or delivering a speech for my campaign or something. So it's just very foreign to us because that's how we revere public spaces, to see those buildings used in that way. Thank you, everybody.
We now return to our previously scheduled program, already in progress.